As a pelvic floor physical therapist, I always have to educate my patients like what pelvic floor physical therapy is, how it can help, why it is such a underappreciated area to treat, and what else it can treat outside of what they think. So I had a patient coming to me because she had pain with intercourse, which is a super duper common diagnosis that we treat all the time. It is actually called dyspareunia, or you could say vaginismus as well. Slight nuances, whatever, semantics. We were talking about how her doctors and physicians and OBGYNs have never once told her about it in the past. You know, she's in her 70s. It's crazy that no one has ever told her about it before. It was like, yeah, unfortunately, people do not know about us. People do not know about pelvic floor physical therapy. People do not know all the things we treat. So I'm saying this to say all the things that we treat as pelvic floor physical therapists and that you can get physical therapy treatment for. So obviously, pain with intercourse is one. Prolapse, any type of prolapse. We want to prevent the prolapse and prevent you from getting surgery for prolapse or needing a pessary. We don't want that. We want to treat vulvodynia, any burning or real sensitivity to your vulva and vagine. Preparing for labor. I have a pregnant patient right now who just entered her 3rd trimester, and her goal is to prevent tearing and have a smoother delivery. Like, that is a goal for physical therapy. Postpartum recovery. A lot of my postpartum patients suffer with incontinence, any type of leakage, returning back to their typical exercise routine, pain with intercourse. Like, there's so many things we can be seen for postpartum. Type of incontinence is something that can be treated by physical therapy. So you have a bunch of different types of incontinence. You have mixed, you have stress, you have functional, and then there's also urinary urgency and frequency, which is pretty much bladder retraining that we do as physical therapists. And a lot of these things happen, like multiple things can happen at the same time, right? Like multiple things can be true at once. So a lot of the times we're tackling things from a couple different aspects, and we can all be treated by pelvic floor physical therapists. So if you're listening to this and you have one of these diagnoses and experience these things, go ask for a referral to pelvic floor physical therapy, do your research, and please get treatment, because you don't have to live this life